This morning inside your spotlight, the Ministry of Health launches a brand new NCD hotline. This morning I want to welcome the Director of Non-Communicable Diseases Unit, Dr. Maria Clapperton. She joins us via Zoom. Good morning, Dr. Clapperton.
Good morning. Good morning, Trinidad and Tobago. Thank you for having me this morning.
How are you doing this morning?
Good. Very good. And you?
Nice. All right, so tell us what the data is showing as it relates to non-communicable diseases, because I know we've been monitoring for some time, we've been talking to the public about it for some time, but where does the data stand as we speak?
Well, in terms of NCD-related mortality, data from the Central Statistical Office in 2018 showed the top 4 causes of NCD-related mortality to be 1, cardiovascular diseases such as heart attacks, 2, diabetes, 3, cancers, and 4 would be strokes. So all of this to say that, the focus at the Ministry of Health would be to focus on tackling diabetes and hypertension, very vigorously, as this approach focuses us to address the wider issue of cardiovascular disease. And this would be in the first instance. So with this approach, we would be addressing 3 out of the top 4 leading causes of NCD-related mortality in Trinidad and Tobago, according to this data.
All right. And one of these, so this approach includes encouraging people to do their home testing?
Correct. So it is definitely an approach that is built and based on primary health care and preventative care. So we want to empower persons in Trinidad and Tobago to take ownership for their health. So the NCD hotline, as you would have introduced, is part of a wider initiative known as the Diabetes and Hypertension Self-Management Initiative. And self-management, as the name would suggest, would be to empower persons to look after their numbers in this instance. So for persons who have a blood pressure machine at home, who have a blood sugar machine at home, we would like to empower you, educate you, share the information as to what the normal numbers look like and what do the numbers actually mean, so that you are able, for those who have high blood pressure or hypertension and those who may have diabetes, so that they can better manage themselves and document their readings at home, as this would be very helpful not only to themselves, but to their physicians when they keep their clinic appointments.
Right. So, Dr. Clapperton, just to be clear, this approach is taken by people who already have diabetes or hypertension. That's you should have a blood monitor machine at home. You should have a pressure machine at home and that kind of thing. But what about those who may not have it yet, but they might be prone? Should we be having those machines at home to monitor our levels?
Yes, so this is a wider communication strategy for those who do have and for those who don't have. Because what the communications campaign is called Know Your Numbers. So at the Ministry of Health, we would have launched the TT Moves initiative many years ago, led by the Honorable Minister himself, the Honorable Minister Terence Dialthing. And TT Moves would have 3 key messages in inception. And that would be to encourage persons to increase their daily intake of water, to increase their daily intake of fruits and vegetables, and to move more. And now we've added a 4th, which is to know your numbers. So that empowerment is not only for those who are aware of their current status in terms of diabetes and hypertension, but for those who are not aware, we want to make you aware of the importance of getting your blood pressures checked, getting your blood sugars checked, getting your cholesterol checked, and your HbA1cs, so that you could be more in touch with what your health numbers mean to you and what your current health status is like. So with the hotline, anyone who would have checked, even if it was using a machine that they had at home, their neighbor may have checked it, or they may have even gone somewhere and had these readings checked. If they are unclear and they would like further information, they can call the hotline, and we have professionals on the line to provide further information and explanation to link them to care.
All right, so just to be clear, Dr. Clapperton, the people who are answering the phones on the other end of that hotline, are they Or can we say they're qualified physicians? Are they doctors? Are they workers at the Ministry of Health with the right information? Just in order to make the transparency as clear as possible.
To reassure you, we have a cadre of physicians on the other end of the phone, and they also have connections to another senior physician who would provide that oversight and coverage. So, it is there, and we would really like to encourage persons to take advantage of the opportunity. It's a pilot initiative. As you can see, it is very forward as it's in the realm of telemedicine. Which would have come to the fore very much so during the pandemic, where persons needed to stay at home. And we are continuing these efforts to bring healthcare closer to you.
Nice. So, Dr. Clapperton, you mentioned the TT moves, you mentioned, the drinking water, eating your vegetables, and that kind of, all that great stuff that we've been talking about. But are there any other preventative measures or management strategies that the public can follow to address NCDs?
In terms of addressing modifiable risk factors, these are key, simple measures that we encourage you to do. Another one that was mentioned, which is, yes, knowing your numbers, but going to see your physician for a checkup on an annual basis at least, so that you are aware of your health status before you become symptomatic or feel unwell. Hypertension or high blood pressure is asymptomatic. It's also nicknamed the silent killer. So, you would want to know what your risk levels are like, especially diabetes and hypertension, risk factors for cardiovascular disease, heart attacks, and strokes. So it is good to know these things for prevention, as prevention will always be better than cure.
Most definitely, prevention is always better than cure, and we want to make sure that we can prevent as much as possible. Now, this toll-free hotline, 800-4NCD, that's 800-4623. Just want to be clear, it's a little controversial, but is it only English-speaking citizens that can call, or do we have access to other languages as well?
At this time, it would be English-speaking. We may have a few of the doctors who may be able to assist in an instance where the other language may be Spanish, as several of them may be familiar and may be able to assist as best as they can.
All right. Fantastic. When it comes to integrating this hotline with the other services at the Ministry of Health, so for example, if I were to call the hotline and say that my numbers are X or Y, and we realize that this might be a challenge, it might be even a crisis level, is there an immediate link to the ambulance service or the hospital service, or do I have to hang up the phone and call that separately?
No, that is correct. We have these features in place as well to better support and assist persons in the event that their call turns out to be that of an emergency.
All right, fantastic. So it's all linked together in one and at the Ministry of Health. So you just call in 800-4NCD, and whatever challenges you have, they can be addressed, yeah?
Yes, that is correct.
All right, fantastic. So let's just to go over, to be clear, the support that we can expect from the hotline is to be able to check your numbers, let you know what the right numbers are supposed to be and where you fall on that scale, let you know what preventative measures or management strategies that you can do as well, and if there is an emergency, to assist in that regard.
Yes, so not to check your numbers, but to review your numbers once you have checked them, and to best advise you accordingly, and actually to refer to appropriate care.
All right, fantastic. Well, anything else that we need to know about the hotline this morning, Dr. Clapperton, before we go?
Well, the number is toll free. It's 800-4NCD, as you would have mentioned, 4623. It is a pilot initiative, and we encourage persons to utilize it.
All right, fantastic. Well, thank you very much, Dr. Clapperton, for joining us this morning. Congratulations on the hotline. I hope that Trinidad and Tobago takes it seriously and calls to get the information, to get the right information, and not go and look it up everywhere else except with the Ministry of Health. So thank you so much, Dr. Clapperton, for the work that you do, and continue doing the great work.
Thank you very much. Thank you.
Take care. Enjoy the rest of your day. That's Dr. Maria Clapperton, the Director of Non-Communicable Diseases Unit, the Ministry of Health, just sharing with us the brand new toll-free hotline, 800-4NCD, that's 800-4623, where you can call to get your numbers reviewed, get any assistance that you might need when it comes to non-communicable diseases. We take a quick break and we come back with more inside the Now Morning Show. Stick around.